This episode of Beauty and the Surgeon podcast is brought to you by Let's Get Checked. Let's Get Checked is an online company dedicated to making professional health testing easy and accessible. Let's Get Checked offers fast, affordable, completely confidential at-home health tests from a range of tests from STDs, male and female hormones, and even COVID-19. Listeners of our podcast who are new to Let's Get Checked get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com, trylgc.com/beauty, BEAUTY, and be sure to use the code BEAUTY20, BEAUTY20 at checkout. Do it. Getting tested is important. It's the responsible thing to do, and you know how important I think it is to make sure you understand your labs. Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon. Dr. Martin, how you doing?
I'm doing pretty good. How are you doing?
I'm good. I'm excited about our topic today. I think it's going to be a really good one.
Yeah, skin tightening technology. This is a divisive conversation we're having today.
It is, because people in general think technology fixes everything. So if you're interested in seeing the slides and the video that go along with this podcast, you can find us on YouTube at Jason Martin MD. We don't have the slides are not super involved today, but they are kind of interesting. So we'd love it if you'd check out the video if you are interested.
So it's my belief that technology fixes everything, Amy.
Yeah, I think a lot of people think that. And the picture that I had originally picked for this slide, which I love this one that Sarah found, is really cool. But I found one of a robot basically looking at like a board of a very advanced math problem. And it's kind of like pondering, because I think that, we want to believe that at this point in time, we are in the year 2020, that, oh my gosh, there has to be something that has evolved beyond the scalpel that will fix loose skin.
And I think, people like Elon Musk and all this stuff that's popular in the news, people will just extrapolate from there, and that's the issue. Unfortunately, I hate to burst the bubble here, but technology does not fix everything. And when it comes to loose skin, no matter what you're told on the internet or by a physician's office or a spa, it does not always fix everything.
Right. So we're going to kind of do a deep dive into many of the technologies that are widely used today. Now, we're not going to mention any of them because, as you'll see, there are an extensive amount, and also there's
like 100,000.
There's so many, and these are just the ones in our country. I mean, you go into like Europe and even Canada, like there are far many more devices than this that exist.
And they're far more powerful because the FDA is pretty limiting in the United States. So if you go to some of these other countries, they have these crazy devices. Yeah. That have a lot more complications and risks associated with them. So, but we're definitely going to go through the ones that are very popular. And I would like for Nils to put in like a ring, like a ding ding, like for boxing.
Oh, like we're
gonna do some rounds. Let's put all these devices against each other.
Yeah. So if you have heard about CoolSculpting and all of these like elusive, magical fat melting devices that tighten skin and do all these magical things, we're gonna
think about unicorns and rainbows.
Yes, we're gonna talk about all of that. So let's first though talk about what causes loose skin. I think the number one cause of loose skin is just aging.
Oh yeah.
Like as we age, our skin loses collagen. We stop producing the factors in our skin that makes it strong.
We have a really good episode on that. So go check our library to see all about what happens with your skin when you age.
Yeah. Another cause, of course, is weight loss. So even people at a normal weight who might lose weight rapidly because of illness, if you lose weight because you want to, if you've gained weight and then lost it, pregnancy, all these things, anything that leads to weight loss can definitely lead to loose skin. Now, in a lot of cases, that skin laxity will tighten itself back up, especially if you're very young. If you gained and lost weight really rapidly, you have a better chance of kind of getting a little bit more bounce back. Pregnancy, a lot of women, you're still young enough, you have a lot of collagen in your skin, it'll bounce back pretty well. But then also medical conditions, and we talked about this on our podcast where we talked about the causes of aging, essentially.
Oh, yeah. Ehlers-Danlos is what I think of first.
Yeah.
You should Google that. That's a really interesting condition. There's different types of Ehlers-Danlos, and many of those types, they really have real loose skin at an early age.
Yeah.
And also with the weight loss, it's usually rapid expansion or notable expansion and then loss. And you get to a point, just from a physics standpoint, that everything gets so stretched that it just doesn't go back.
Right. And also the added volume of skin, as you gain weight. So especially if you've been overweight for an extended period of time.
That's a really good point.
Your body makes more skin.
Right.
Yep.
And that's the kind of basis behind tissue expansion. We do it all the time in plastic surgery. We'll put I know this sounds crazy, a tissue expander underneath the skin and expand it out. And when you get pressure underneath the skin in itself is encouraged to replicate, and it just keeps creating more skin. And so that's what fat does underneath in a kind of different type of way, but the same idea. And then when you lose the weight, you have all that extra skin there.
Yeah. So, it's your body doesn't necessarily get the signal to break that skin down. Like I said, it can happen over time. If you give it time, your body will remodel itself. It's constantly breaking down these cells on a daily basis and building new ones. So it will adjust to your new smaller frame. But if you have, lost a massive amount of weight, that skin is it's never going to come back fully. Like it will get better, but it's never going to come back fully.
There is that rare patient that you and I see that, because, in our private practice where they lose 100 and 150 pounds and you're looking at them, you're like, oh my gosh, how much they contracted down.
Yeah.
I mean, they still have loose skin, but they look pretty good.
Yes. And that's usually genetic or age.
Yeah. Or
people who are under 25.
Yeah, it's usually younger people.
Yeah.
Okay.
So let's talk a little bit about what's going on underneath what we see on the surface.
Yeah, we got this from Wikipedia. I was all in the Wikipedia page on human skin. It's actually really good, by the way. And I know that's crowdsourced, so I was really impressed. I'm seriously.
There's some good info on Wikipedia.
Yeah.
It's not all made up.
No, it was really good. Actually, it was as a scientist and a physician, I was really impressed. So the skin has two different layers: the epidermis, which is the outside layer, and the dermis, the deep layer of the skin. The dermis is really where all the action happens, and that's where you have collagen. Collagen is what gives your skin integrity, makes it thicker, and gives it a good quality to it. This is also where the pigmentation cells are, the hair follicles, and the blood vessels, and everything else. So it is really in that dermis layer, that's what changes with weight gain and weight loss, with aging, and even in this dermis layer is where you have these medical problems. That's where it's affected. It's really not the outside layer of the skin.
Yeah, it's below the surface.
Below the surface.
Slightly. Yep.
The outside layer of skin is what we treat in spas. And when you come into our office and you make the skin look better, the quality of the skin, we get microdermabrasion and facials and stuff like that. But the deep dermis, or the dermal layer, the deeper layer of the skin, is what you want to treat when you want to tighten the skin.
And these things naturally reduce with age. One of the things that is not brought up on this slide, which is actually a really important part of skin aging, is elastin. Elastin starts to decline in your 30s and it doesn't replenish. So like collagen, you can get, we'll talk more about some home things, but you can drink collagen, you can put collagen on topically, like there are collagen treatments.
Does it actually work?
Yeah.
Because you always see those collagen drinks and you're like, oh, this has to be bogus.
No, it definitely is going to help add those building blocks. So it's basically just like giving your body more, because you're still building collagen. Like you still have the ability to make collagen as you age. Your ability to make more elastin is basically over.
Right.
Like you build elastin until a certain age in your life and then you basically stop. So these things, that's why so many of these treatments that we're going to talk about focus on encouraging collagen production, because even though elastin has far more to do with the elasticity and the tensile strength of our skin, you can't replenish it as readily and as easily as you can collagen.
Yeah, so the collagen gives it structure and the elastin gives it that elastic
Tensile.
quality. Yeah, like the rubber band effect.
Mm-hmm. Which makes it snap back.
Yep.
and or not.
And that snap back quality really does define age. So if you look at young kids and you're like, wow, their skin's quality is so good, it's really because of the high percentage of elastin that's in there.
Yeah. So it's pretty cool. I mean, just as always when we talk about the functions of the human body, it's so fascinating what's really going on every single second of every single day, from the day you're incepted until the day you die. Your body is making cells.
Do you think anyone else thinks it's so amazing like we think it's amazing?
I think
this is what we talk about all the time. This is like literally why we started this podcast. But hopefully get on the Wikipedia page. It's actually really good. Read about skin.
So Dr. Martin has 2 golden rules, and I'm going to let him read them.
No, you read the golden rules.
Okay.
It's actually because you have more of a dramatic voice.
Oh, okay. Golden rule number 1, non-invasive options are at least 50% less effective than less invasive options.
Okay, so what does non-invasive mean? I know we're going to go through this again, but what does non-invasive mean?
It's basically topical, so things that are not
penetrating your skin.
Well, in some cases they are minimally breaking the skin, but they're not under the skin. How about that? They're still done from the top.
Okay, I'm with you on that.
Yeah.
There are some like hybrid ones we'll talk about. One of them we have, but in most cases, these are the things that work on the outside.
Yep.
Like think a laser.
Right. Like they're working through your skin, not under your skin. And as we talked about, the skin is not really, the surface skin that you see is not in most cases the issue of laxity.
So if you go somewhere and they have a technology that tightens the skin, but it doesn't go underneath the skin, it will automatically, my golden rule, which is 100% correct, it's been data proven.
It's the golden rule.
Yeah. Will automatically be 50% less effective than something that goes underneath the skin, no matter what they tell you. Okay. Golden rule number 2, Amy.
Golden rule number 2, less invasive options are at least 50% less effective than formal surgery.
Yeah. So, meaning that things that work underneath the skin, treatments in the office, are going to be at least 50% less effective than the surgeries I do on a weekly basis. So, anything that tightens your belly skin underneath the skin, something super new and technology driven, is going to be 50% less effective than a tummy tuck.
Yep.
No matter what anyone says, no matter what video you watch, no matter what you read, go back to Dr. Martin's golden rules, 1 and 2.
Because there really is no replacement for actual excision of skin for laxity.
When you read this replaces surgery, just realize that was written by a marketing person, not a scientist.
Yes. So those are great golden rules.
Okay, good.
And now we're going to take a very quick break, and we'll be right back after a word from our sponsor. Dr. Martin, I'm super excited to talk about our sponsor for this podcast, Let's Get Checked. If you've been a listener of our podcast, you know that we have never had a sponsor before, and that's because we're an educational podcast. We're not looking to monetize, and we also would never recommend something that we didn't believe in and or use ourselves.
So basically you're saying we're very choosy.
We're very choosy when we come to our testing, but Let's Get Checked really aligns with our values. We talk a lot about monitoring your blood values of certain things. We talked recently about vitamin D serum levels. We talk a lot about hormone levels, and it's hard for some people to get to a lab, or you're afraid of the blood draw, or just, you're concerned about confidentiality. Like you have a lot of concerns and you just don't do it. Let's Get Checked makes it super easy because it's completely confidential. You do it from your home. So there's really no excuse not to do it.
Yeah, and we did it recently. Both Amy and I did it. She looked at her women's health, basically her hormone levels, and I looked at mine on the men's health side with testosterone. It was very simple. You go online. Their online interface is really easy to use and good. We got the testing kit very quickly, and the test itself, actually doing the stick, you do a stick on the end of your finger, is not hard to do. It only took about 3 to 4 minutes. You put it back in a sealed envelope that's confidential, goes back to them. You get your results in 2 to 5 days. It's really that simple. And the best part is it's about empowerment, about you taking control and trying to do things that are positive for your health and life. And this is one way to do it, literally from the comfort of your own home.
Yeah, so they offer a wide range of tests. So they do men's and women's hormone panels. They do a full panel of STD testing. They also are now offering a COVID-19 test at home. So there are a lot of other just basic blood levels that you can get tested as well. And one of the things that we always say is you can't track what you don't check. So you might not know what's normal for you in the future if you're not checking it now, especially as it relates to hormones. And men's health specifically, I feel like is a little bit undertreated. I mean, sperm counts are dropping by a large percentage in men these days. Most men struggle at some point in their lifetime with low testosterone.
And those men do not know what the symptoms of low testosterone are. Depression, anxiety, sleep problems, osteopenia or loss of bone, loss of muscle, and something we treat all the time, gynecomastia or male breast growth. These are real problems that can be improved or treated with testosterone. And these men do not know their levels. It's so easy to get checked. And this is why we're so excited about the sponsor.
Yeah. And Let's Get Checked is a completely CLIA certified lab, the CLIA lab. So they're a well-established, completely safe lab to use. You do get contacted after, so you get your results. I got a text at 4:30 in the morning, which I loved, that my results were ready.
And we're both up at 4:30, so that was good.
Super excited. And you have access to not only a nurse, but also a physician. So a physician does review your results, and it gives you a little breakdown of like where you're sitting on those levels. Dr. Martin's had even comparisons of like where 2 of the levels should be in relation to each other, which is a really important thing to note.
Right.
Just being within the normal range is not always enough. So it really gave more information than that. You'd still want to, of course, reach out to your own doctor if you needed some additional assistance with these labs or you did see something that was concerning. We didn't, thankfully, so that was good.
Yeah. We were both good. This podcast is about empowerment. It's educational. In my private practice, I'm a board certified plastic surgeon. We are all about empowerment, and this is one way to do it. So we're very excited about the sponsorship, and we're looking forward to using it for our patients moving forward.
Yeah. So as a listener of our podcast, if you're also a new time user to Let's Get Checked, which a lot of you probably are, we do have a 20% discount code. So you do need to go to our specific URL, and it is linked in the description box below, but it's going to be TryLGC. So TRYLGC, like Let's Get Checked.com/beauty, BEAUTY. And you'll need to use the code BEAUTY20 at checkout. Beauty again is BEAUTY 220. And you can pick a test, like any test you'd like, put in our code and get your test shipped to you. Getting tested is the right thing to do. It's let you know where you're at and what's responsible.
All right. Well, let's get tested.
Let's get tested. Let's get checked.
Let's get checked.
And we're back. So now we're going to start talking about what some of these options actually are. And we're going to start with the non-invasive and kind of move into invasive. And then we're going to talk about some alternative options as well.
Right. So one of the issues is we have not tried the 5,000 million technologies that are on the market. We have tried many of them, and probably more than most offices. So I do feel that we are capable of discussing these technologies. Okay. In general, we've tried every different type of technology. And what I mean by that is that the technology that's used at the base of the, why am I having difficulty saying this? The technology that the device is based on, we've tried every different one of those. Ultrasound, radio frequency, laser, pulse assisted, all this kind of stuff. So we are very, I think, able to discuss these topics, and we're going to go through some of these options now.
Yeah, so let's first talk about some of the names that you may have heard that some of these devices have. So we'll start with Morpheus 8.
Which we have.
Sounds like a bizarre movie character.
Yeah, it's made by InMode. I don't know who came up with that name, but we're talking about it, so I guess it worked.
Yeah. Contoura.
Yeah, Contoura.
This is so Morpheus 8 is a radio frequency assisted microneedling. Contoura is an external fat melting radio frequency device. VivaRF is, again, a microneedling radio frequency assisted device, and also a bipolar radio frequency magnet to tighten skin.
CoolSculpt Cryolipolysis. This is the one that everyone knows.
Everybody's heard of CoolSculpt. You've seen the billboards.
They barraged the internet like 3 years ago, and for some reason, the first thing they think of with fat reduction is freezing the fat. So cryolipolysis uses external application of cold temperatures to cause destruction of the fat.
And this actually CoolSculpting came about as a side effect of dermatologists trying to find ways to topically numb the skin without using lidocaine or anesthetic.
Right, and there was multiple things. That's true.
Yep.
Another thing, which I thought this was so interesting, in cancer patients, specifically the pediatric population, children, they were using fentanyl popsicles, okay? So fentanyl is a really strong painkiller, and kids aren't great with pills, and obviously they don't want shots, or that would be bad for kids, and so they would put it in popsicles, and the kids would suck on the popsicles, and these were a couple a day, right? Because these kids were really suffering, and they found that there was fat loss in their cheeks, right? Because kids have real fatty cheeks, and they would have deformities, and they noticed that was really interesting, and then they started to research that. That was out of Harvard, so that's where it all came from. You're exactly right.
Yeah, M-Sculpt. Again, you may have seen this online. It is what do they say, like exercise. They call it something like exercise in a
give yourself a six pack. And that is kind of like, what's the technology behind that? It's magnetic.
It's and EMF or electrodes like a TENS. It's basically like a big TENS unit.
Yeah.
So it contracts the muscle.
Contracts your abdominal muscles.
Yeah, or your glutes. So you put it on there, and it's like a big paddle essentially, and you put it on there and it contracts. It makes it like contract. They used to sell those online, like the ab belts. That's all it is. It's like a big TENS unit.
There's more to it, but that's basically what it is. It has a magnetic quality to it too. I would actually highly advise you to watch a video on that. It's actually kind of funny.
Yeah, but I mean, it's causing the muscle to contract, so that's the basis behind that one.
By the way, M-Sculpt, there's a lot of plastic surgeons that are reputable that I know. They're my friends, board certified, that have M-Sculpt, and they do like liposuction with the M-Sculpt, and so there definitely is something there.
Yeah. My advice is to do squats to build your glutes.
That's crazy.
Build your glutes for life.
That's not a technology. Is there a squat technology?
Yes, it's called a barbell. It's called lift heavy weights. Vaser shape is another external. It's an ultrasound kind of thing that smooths over the skin. It heats up the tissue.
And it takes it takes ultrasound waves and it like points them into your soft tissue and really creates heat. It can be kind of painful, actually.
Yeah. Sculpture is another one that's using like a kind of ultrasound paddle.
No. I think sculpture, well, God, these names all bleed together. Sculpture is the one that uses lasers, right? That's made by
Cynosure, but it doesn't. They're paddles, though.
Oh, okay.
But some of these, I guess, do have. Actually, no. Do they have? That one has the 650 wavelength in it. They're flat paddles, though.
Right.
Yeah. So I did.
To that point, what she's talking about is that LED lights actually have been used to destroy fat. There's a certain wavelength that supposedly, quote unquote, can penetrate the skin and cause loss of fat.
Yeah, like one I didn't put on here that we have is Smooth Shapes. Smooth Shapes is a laser, and it has two
an LED
frequencies.
light.
Yep.
And an LED light.
Laser and LED light, but it also is an entomology machine, so you basically roll and massage the tissue, so you get this kind of dual effect of like perhaps some benefit of the laser and the LED light, but you also get like a plumping of the skin from just the pure fact of doing and like the entomology treatment.
Unfortunately, it's temporary. It's good for the offices because you have to keep going back and paying them
Botox.
for treatments.
But there were people who loved it. Like
you do it before a wedding or something, or you go to the
before
beach.
Beach vacation. Yeah. Like it'll plump up that tissue and have to kind of smooth the effect.
People don't show their upper thigh at the wedding.
I mean, not at the weddings I've been to, but I'm not from Kentucky.
Okay. Hey, that was a low blow. You're from nowhere, Colorado.
That's right. I mean, seriously, there's probably more people wearing like mini skirts at their weddings in northern Colorado. Yeah. So Vivase is a radio frequency microneedling. Yep. So is Secret RF. So, and I put et cetera, because I mean, we could go on and on and on. There are as many devices as there are names that can be thought of.
Yeah.
But they all use one of these basic components. CO2 laser is one I did not put on there because CO2 is not really specifically for skin tightening. It's more for skin resurfacing. But anything that's causing that heat and that kind of surface damage is going to, in theory, tighten the skin slightly.
Yeah. If you have any fractionated laser, and most people know these, like when you go to whatever clinic or spa you go to, those usually penetrate the skin past the epidermis, which we showed you from the Wikipedia page, and go into the dermis and cause collagen production. And then there's even injectables that actually go underneath the skin that cause inflammation and collagen production. So this list could go on and on.
It could. But the point being that most of these things are using one of kind of three types of technology to do a very similar thing. They're causing damage and they're causing heat, sometimes both. So what that does is that, in the ones that cause like potentially fat necrosis are damaging the fat cells, right? With either heat or cold. CoolSculpt is the only one that in this instance uses cold, but they're causing those fat cells to essentially break apart because of the heat or because of the cold, because of the damage essentially.
So the heat causes collagen production, and then the energy effect on the fat cells can cause lysis of the fat cells or destruction of the fat cells. And that can be ultrasound. That can be even an LED light, like a light wave. These are all just forms of energy that really have an effect on the cells that are there.
Yep, underneath. And then the others like the radio frequency assisted microneedling and some of those other things like lasers are going to be causing surface damage and with heat, so they're damaging those very surface layers of the skin, mostly causing bleeding, which is bringing more nutrients to the surface of the skin. It's causing it to bleed. It's causing it to heal. So these little micro injuries, they're very, very tiny, but they cause the skin to have to heal. So that's why we use microneedling over scars. It causes it to have to kind of continue being active. And it does the same thing on the surface. So this is a good overview of things that are like completely not, this does not mean that these are not painful. So I've had some of these done and some of them are extremely uncomfortable.
Yeah. And even, by the way, CoolSculpt can be really painful.
Extremely painful.
Yeah.
Yes.
So the idea that these are painless and surgery is this awful thing, and I understand I'm a little bit biased because I do both for a living, but I think we need to like bring the truth here is like these things hurt too, right?
They do. And some of them require a lot of downtime. Mm-hmm. So, and they're not free. Like some of these are actually quite expensive. I mean, I've had people, tell me the quotes they've gotten from providers for some of these external treatments that are more expensive than actual formal surgery.
Right. With us.
Because they
with
require,
a reputable office,
yeah.
That does this on a weekly basis in the office with you awake under local anesthesia.
Yeah.
And you're going to tell me that you want a more expensive option that is, let's see, the golden rule, at least 50% less effective?
Yeah, at least. And that's maybe even 50% of 50%.
Right. And I think the main reason is that people really are concerned about scarring and they feel that something more invasive has more risk. And that's actually true, okay? but the risks are not as great as the marketing makes it out to be.
Yeah.
If you go to an office like mine, again, a board certified physician, those risks are mitigated. And to be honest with you, I would argue in my hands, the risks are less than some of these non-invasive treatments, which have a lot of side effects that they don't talk about.
Side effects, and also, I mean, anytime you're causing heat and or cold on the skin, you can have side effects. You can get burns, you can have scarring, like permanent scarring. Hypopigmentation, meaning you lose all the pigment in the skin, can happen from these deeper laser treatments. You can get this kind of weird glassy effect to your skin if you over exfoliate it like for a lot of times. Like even like if you're doing deep chemical peels, you're doing deep CO2s.
Yeah.
Like,
and you see that if you look at someone who had like a facelift and resurfacing in the 90s, and so usually it's obviously someone older in their 60s and 70s, their skin looks transparent almost because it was so aggressive.
Yeah, kind of glassy.
Yeah.
So those things are not reversible. So if you have hypopigmentation, like it's not, you can't reverse that.
Is this where we talked about hyperplasia and CoolSculpting, or
Yeah.
no? Or should we leave that for later?
Yeah. No, this would be the time to bring it up. I mean, I think that really leads into the fact that these things all rely on technology to produce the result. So yes, there is a person operating this technology. However, the limitation of the person operating it is the technology itself. So with CoolSculpting, you literally place the thing.
Yeah, and by the way, and this is not a criticism of these people. These people that are applying this are not trained. They are medical assistants. At the most, they're nurses. Rarely would it be like a mid-level, like a nurse practitioner or a PA. It would never be the physician. If it is, that would be very unusual.
Well, but even if it is.
Okay, that's fine. But I'm just saying that like they're applying it the way that the company or manufacturer instructed them to do it. There is no creative thought process to this. Like it literally, they have a book that says apply the paddle here when you want to do this type of paddle for this long. They're following a cookbook instruction manual. So
they're highly trained on the device, but that's a good point that it doesn't matter if you have a medical assistant doing it or a physician doing it. All they're doing is doing it, right? They're each just putting that paddle in that place and walking away.
So let me say this differently. Whoever's listening to this episode, you could come into my office and we could get a CoolSculpt and you could follow the cookbook directions and you could apply the paddle exactly like they said after a 1-hour training session.
Yes, but you're still, ultimately, no matter who puts that paddle on, you are relying on the technology itself to actually produce the result. So you're limited. So that's it. It's as customized as the moving the paddle around in maybe a way that they've decided works the best, but that's it. Like that's all you're going to get out of it. It doesn't matter who does it. This is it. This is what you get with this technology is what you get.
And CoolSculpting is a good example because then the CoolSculpting people would argue, oh, Dr. Martin, wait, hold on there for a second. Because we double stack. We do different, we layer, we do different type of treatments. And I've had a CoolSculpting device. I know all about it. And I agree, you can actually push it, but you're going to push it 5% further, 10% further. It really is not, it's, in the whole grand scheme of things, it's fairly nominal, the improved effects you can have.
Yep.
And that does take experience to start stacking it and doing different type of treatment modality or treatment modules. And so I'm going to give a little bit there, but overall, you're not going to really push that threshold further.
Right. And the same thing with the devices that work on the surface. So yes, you can increase the intensity of these radiofrequency treatments within a range, but at some point you're going to cause too much damage, which then can lead to some of these adverse side effects. So you're still limited. I mean, you can, people do, and they stack like, the Morpheus or Contoura treatments, they'll do multiple passes and really aggressive treatments, and people will be, red for extended periods of time and really swollen, or do a really deep aggressive laser where a person is put to sleep for it. At some point, though, you're limited with the amount of damage you can cause safely. So it's limiting.
Not to pick on CoolSculpt, I'm not, because there's so many other devices I could pick on.
Oh, pick on Sculpture, it's the same thing.
I will, but when you destroy fat with cold temperatures, you do not, okay, let me just say this again for emphasis, you do not tighten the skin. I have not read data that shows that, cryotherapy really leads to a lot of skin tightening. So if CoolSculpt worked as well as they say it works, which it doesn't, and you had a lot of fat loss, you're going to be left with, so that's why I think the skin tightening component, if you're going to do CoolSculpt, maybe have them also do something in maybe a delayed fashion that would tighten skin too, if you really care about that.
Yeah, well, which we are talking about skin tightening, so the person listening to this probably does care about that.
There you go.
Yeah, so these external things, they're also not taking anything out. So the fat that is hypothetically destroyed by whatever treatment you're having, whether it be CoolSculpt or Sculpture, Vaser Shape, any of these things that are causing these fat cell walls to explode open and dump all this, toxic waste from the fat cell into your system, your body has to absorb that.
Amy's not biased
No.
at all.
But that also
just toxic load.
Yes.
And you may die.
Our fat cells is where we store a lot of waste in our fat. Yeah.
And which is why, actually, when we talked about this before in a previous episode, when you lose weight fairly precipitously, you tend to not feel well. And part of the reason is you're releasing a lot of stuff into your system that's stored in fat. Many things that are toxic are fat soluble too. And that includes, by the way, inhalational anesthetic agents, which is why you feel so crappy after general anesthesia, because it stores in your fat cells and then gets released slowly over the next 24 hours.
Yeah. Chemicals, heavy metals. I mean, our bodies use fat to store a lot of insults essentially to them. So it's important to make sure that if it was me and you were going to go do one of these non-invasive fat reduction procedures, I would highly recommend you make sure that your liver function is good so you can process out all this fat junk if you believe that it's actually going to burst open your fat cells and work. So get your liver functioning. All right. I think we have doubled down on non-invasive.
We're not against, I just want to make it real clear. We're not against non-invasives. And there's a lot of people that come in that have medical conditions. They can't do surgery. These are great options for you. There's people that really can't afford surgery.
These are not necessarily cheaper than surgery.
I know, but in some cases they are. So non-invasives, whatever, Groupon, whatever you get to get some.
Don't Groupon your surgery.
Okay. And then there's people that really just don't want surgery. Just like in their mindset. I love those people. I'm cool with that, right? Like that's fine. As long as you know the truth, then you can make a really educated decision. And obviously the reason we do this podcast is for empowerment. I mean, that's why we're doing this. So you need to know before you go into this office, you need to be an educated consumer. You need to teach yourself and you need to go in there eyes wide open and then, make a decision that's best for you.
Yeah. And some of these things are generally more maintenance procedures as well, which we'll kind of talk about in the end, what things are more like maintenance. But just, like you said, Morpheus is not a facelift and CoolSculpt is not liposuction. So
that's true.
That's my
mic drop.
Yep. That's my
ding ding
Cliff Notes.
You got to put that in notes, please. You have to. I don't know how hard it is.
Cliff Notes version.
Yeah.
Okay. So let's talk about invasive options. And then we're not talking about formal surgery. We're talking about invasive options that are working under the skin. So these are things that we consider surgical, but they're not actually skin removal.
Right.
So
this is where we have an immense amount of experience, and we've tried pretty much almost every one of these on this list. BodyTite, which uses radiofrequency lipolysis or radiofrequency energy to destroy fat and tighten the skin. FaceTite, which is a similar technology, and AccuTite, which is similar also. Vaser, which is a great device, uses ultrasound energy to break up the fat and tighten the skin.
Yeah, it's pretty slick, actually.
It's really cool.
I think Vaser's really cool.
Yeah, Vaser's been around for a long time. Ultrasound-assisted liposuction has been around since the 90s, and Vaser just perfected it. And it's like an older device on the market, but it's really good. I don't know what comparison with cars would be, like some older, like Ford F-150 or something. I don't know. Like it has that quality to it. Like it's just always good.
Yeah, it's always good. Works.
SmartLipo, which is laser lipolysis, and Amy put SmartLipo in here, but there's like 1,000 different laser lipolysis.
This is just probably the most well-known laser lipolysis.
There's tons on the market. Yep. They all use certain wavelengths. We don't have to go into that. I know all about that kind of stuff, so research it. There's certain wavelengths that are better. That means wavelength of energy that's going in there or light that's going in there. Renuvion, that's a newer device on the market. It uses cold plasma. It's really cool. It injects helium underneath the skin and basically
ignites it.
And causes this ionization and has a low temperature, and it's kind of a cool effect. The data's kind of mixed on it, but I think it's a useful device. Body jet, air sculpt, superficial liposuction, et cetera, et cetera, et cetera. There's more and more and more. These things all work underneath the skin. Okay. Most of these devices that work underneath the skin destroy fat and tighten the skin.
Can I interject really quickly? Because I think this is an important point. All of these things, with the exception of AccuTite, do require at least some amount of aspiration of fat. So they require a liposuction component,
which is... What does aspiration mean?
Sucking. You suck the fat out. That's why superficial liposuction I put on there, because superficial liposuction alone tightens skin. And that's that's why it's important as we talk more about these different technologies to understand that component, like a skilled liposuction procedure, can also tighten skin just by itself with no technology.
Yeah, at least 15 to 20%. That's data proven.
Yeah. So sorry, continue.
No. And by the way, superficial liposuction with 15 to 20% skin tightening, you know how much these external devices tighten the skin? 10%. I didn't say that because no one can understand what that means. But basically, just taking a liposuction cannula with no energy, no technology, and rubbing it underneath the skin, which is a very technical procedure. I mean, you have to be really good at liposuction to do this without screwing it up, will tighten the skin way more than any of these other devices that you go do externally.
Yeah, but that's a good point, that superficial liposuction is a very technically challenging thing to do, which is why a lot of these devices are sold to non-core providers. I mean, they are sold to non-surgeons, they're sold to dermatologists, they're sold to ER doctors, gynecologists, like
general surgeons,
eye doctors,
family practitioners,
like
internal medicine doctors.
Anybody can buy these, but it helps them get a more consistent and better result because they're not a skilled technician with the liposuction component. So they can throw one of these devices under the skin, get a better result.
Treat the skin and then not do an aggressive liposuction, because to be honest with you, besides problems with these technologies specific to things like burns, which these technologies all have safety components to them that really limit the burns, the rubber hits the road with the liposuction. Yeah. So if you put one of these devices underneath the skin and you're not skilled at liposuction, it will still have a big effect, right, because of the technology. And then you do a little conservative liposuction, which is going to be probably safer for the patient if you're not skilled at liposuction, and then your overall results are better. So it's taking a standard liposuction procedure and making it more efficient and higher quality.
Yep. Better, safer. And a lot of these devices do decrease the recovery component a bit. I think to me, the one, and we've used these a lot, BodyTite, I find to be the most impressive in its decrease in the recovery time. You know, SmartLipo and Vaser said they did, and they were probably about on par with recovery. BodyTite, you can actually see that contraction when the patient is on the table.
Yeah, 30%.
Like their swelling is greatly decreased from these other types of assisted liposuction. And part of that is just it's a really interesting technology in that it's circling the heat up and around, which is unique to BodyTite. Like it's heating the skin on the surface and the skin underneath at the same time. I think that's got to be a lot of the reason why, but I have been very impressed in the 3 years we've had BodyTite, how much it decreases post-operative inflammation.
Yeah, it shortens the recovery for sure in comparison to standard liposuction.
Yeah.
All right, so up to this point, in summary, the external devices try to treat that deep layer of skin. They really try, and they do kind of a half job. Things that are more invasive externally, like Morpheus 8, do a better job. Things that are less penetrating do a lesser job in skin tightening, but may be better for just skin quality and improving the quality,
like maintenance,
the way the skin looks. Yeah. But then you take the next step and you do something that we are calling less invasive or minimally invasive, and you do it underneath the skin treatment. You're actually putting energy right at that deep layer of skin, okay? From different types of technology, ultrasound, laser, radio frequency, and all those have differing effects. If you have a one-time effect, why am I having such a difficult time doing the numbers? Like
doing the numbers.
If you have, oh God, I feel like I'm working with my daughter in math right now. Ugh, this is not good. If you have an X amount of effect, okay, just from external, you're going to have 2 times underneath the skin, okay, but those devices do differ. So if you take a BodyTite versus a SmartLipo, BodyTite's going to have a much greater skin tightening effect. So whereas the most that you could get in skin tightening with SmartLipo, which was, kind of at the higher end of effect.
It was powerful.
Yeah, it was like 20% change. BodyTite in some areas could be up to 35%, depending on the anatomy. So you're talking about, this is like literally the apex of where we are right now, is a device like BodyTite. Renuvion doesn't really have all the data there yet, and that may get there, but it's not there yet. So you have things like BodyTite, which is at the top, and then you had to make this big jump to surgery, and that's where we are. By the way, radio frequency is where everyone's mindset is right now. BodyTite uses bipolar radio frequency technology. VivaRF and some of these older devices used unipolar, which is a lot more painful. And so that's where everyone's head is now, is trying to figure out radio frequency, because it's very safe, it's very consistent, and it's controllable. The problem with laser underneath the skin is that it was like very aggressive, and you could have a higher incidence of burns and then kind of weird healing problems like the dermal changes in your dermis or your deep layer skin, which gives you contour deformities. Externally, it just looks weird.
Contour deformities. And also the other thing that we saw with laser-assisted liposuction was the blushing of the skin, like almost like a dermal tattoo. Like it would be like a very persistent bruise. And in some cases, we had patients that would last for months. So it was like a very faint outline of a bruise almost that would get kind of just deep into that tissue. And we didn't see that with other types of technology. We only tended to see that with the laser technology. So I don't know what the reasoning is there, but that was definitely something we saw. And I think maybe just the intensity of bruising that you'd get with those procedures.
Yeah.
Yeah. So there, obviously with the invasive options, there is potential for slightly more downtime, but not always. Some of these external things, like we said, are painful. All of these invasive options you're thoroughly numbed for. And
all of them you should be able to do in the office if the areas are limited.
Yeah. You can do these awake. Yep.
Awake.
Yeah.
So no anesthesia in the office under local anesthesia.
Yep. So your downtime may not be all that much more. And like I said, in a lot of cases, these more invasive options, like Dr. Martin said with his golden rules, are going to give you a far better result than the non-invasive options. And the downtime and recovery is really not that bad.
No, it's not.
Like it's
but
really
there is
not.
definitely more recovery. Like some of the non-invasive devices, quote unquote non-invasive, they call it lunchtime treatment. Like you go in there and do it and then go back to work. These kind
That's what AirSculpt says. They say they're lunchtime lipo.
Okay. You go AirSculpt.
I know, right? It's like you talk to people who think that they can go have CoolSculpting on lunch, and they're having to call a friend to drive them home because they're in so much pain. I mean, pain's subjective.
We got to lay off CoolSculpt.
I mean, any of these things.
We're picking on CoolSculpt because they own most of the market.
Well, and people know about them.
Yeah.
I mean, obviously,
we're not going to hurt CoolSculpt.
No, you can do M-Sculpt and obviously have no pain or discomfort. Maybe your abs are a little sore, but you're happy about it. You do a Viva diamond tip treatment. It's external. You literally have no difference in your skin when you leave.
Yeah.
Like there's a lot of these things that only make your skin look better. So those, these are definitely not that.
But the more invasive options, this is the rub, okay? So you're going to get, golden rule, 50% more, like 100% difference between one to the other. But you have to go to someone who's technically better. So what we're really proving now is that technology alone is not enough. It has to be technology with a human being.
Yeah, technology and technique.
Sorry, Elon Musk. You have to have both of those together, and that's true in autonomous driving, right? Like, so you can get on a highway and a Tesla can go, but it cannot right now go down a street and understand street signs and people walking and all this kind of stuff. The same thing with this. Like, you need the human being there with experience to be able to guide some of these deeper treatments. And so that does put stress on you, right? Because the limitation of things being cookbook is also a benefit to you. You could go into any place, and as long as they follow that guideline, you're probably going to be okay. Whereas with these kind of things, you unfortunately have to go, well, not, or fortunately, whatever, have to come to an office like ours that are highly experienced, preferably board certified, preferably a plastic surgeon or something like that.
Definitely a board certified plastic surgeon.
Yeah. So, I mean, it just depends on where your mindset is.
Yeah. And that's really, to me, the biggest difference, and this is when I talk to patients about these things, there really is no substitute right now for technique. And you only get that with a skilled practitioner with these internal treatments. And we have seen patients come to us and that have undesirable outcomes from these treatments with other providers. Now, you don't know what happened during that case. You don't know how they looked before, so you're only presented with what they look like now. But we definitely have seen patients who had, oh my gosh, like full thickness skin burns with the SmartLipo, especially the first version of the SmartLipo, because if that laser is hot and it's pointing in one direction only, so if it got too close to the skin, really before you knew it, that could penetrate those skin layers or cause so much heat in one area that it would almost like a volcano underneath, like burn through the skin layers, like really quickly. So things can happen that, are inherent risks of using technology, which is why the technician side of things should never be downplayed. Like, these technologies are amazing and we love some of them. Like, I mean, I truly am amazed at the results we get. I mean, even from our Vaser and SmartLipo days, like we would get awesome results from those. BodyTite has blown those out of the water. I mean, FaceTite and AccuTite are incredibly powerful and do amazing things, but it still requires the person operating it to be very technically skilled.
Right.
And there's no substitute for
There's
that.
no substitute. And,
That's why my thinking robot was so good.
Yeah, maybe in 20 or 30 years. I don't know.
Maybe that they'll run themselves.
Yeah.
Yeah. And that's possible. But at least right now, the technology's awesome. But
So I was just looking through the internet when we were
I was just looking through the internet.
preparing for this, and I happened on this article. It was recently. It was like a robot sewing. It's like a robot out of Stanford. You know, one of those kind of fancy California schools. And I was like, oh, this is amazing. And I went on there, and the dude was doing whip stitching, like the least difficult, not technical stitching, and they had worked 5 years
To make a robot whip stitch.
Whip stitch, and I was like, no.
Right,
Like,
whip stitch.
if I whip stitch something, the patient's gonna be like, Dr. Martin, I thought you were like a, amazing sewer. Like, I thought this is your technical abilities.
Well, and I always complain when you whip
I just had the
stitch.
robot whip stitch this,
Yep. You get what you
Yeah.
get and you don't throw a fit.
So
with
we're
the
so
robot.
far off from that. But technology now is really adjunctive, and technology makes me better. My results with BodyTite, SmartLipo, and Vaser are a lot better than liposuction alone. And I've done both. I've been in practice long enough where I've done it from start to finish. And really the difference there is not just the liposuction technique, which really has nothing to do with that. It has to do with the skin tightening qualities of all these devices. So you can take out the fat and tighten the skin at the same time. But we're getting to the point now where you don't have to even do liposuction. A device like AccuTite, really, really interesting device, works in small areas, especially on the face. It can really tighten the skin, and you don't have to do any aspiration or liposuction with it.
Yeah. We have a whole podcast all about AccuTite, which is really great. So you should go back and listen to that. You ready for the next slide?
Yeah, I'm ready.
Okay. So we have a picture up. These
From
are
the American Board of
Cosmetic Surgery.
Cosmetic Surgery.
Basically just shows all the areas where you can use these devices. And you can, these are internal and external devices, can be used basically all over the body. So
Everywhere.
They can really be used just about anywhere. Even things like radio frequency microneedling, they can be used on the skin of the knees, the elbows, like they can be used all over the body with good results in some places.
Right.
So, there's a lot of places these can be used. Let's talk about home options. And I have some props.
Oh, you do?
Yes, I do. Because I actually brought some of these things. One of the things we'll first say the things that are on the list. So, in all these categories, there are none more filled than this one. So I kept this one really short. So NuFace, most people have heard of. It's awesome. NuFace is really cool.
I know, but everyone asks me about NuFace, and I know nothing about it.
It's really cool.
What is NuFace? Is it a product line or?
No, it's a facial massager essentially.
Okay.
It's very similar to things like Zip and Iris. They mostly use either radio frequency.
That really summed it up for me. Zip and Iris. Now I get it.
Oh, well, Zip is what's used by like Halle Berry and all these famous celebrities. So
I need to get my IG on to figure out all these home options.
Iris is one that's meant specifically for the area around the eye.
Got it.
There are so many. Like Clarisonic makes an attachment that massages your face.
Yeah, I know that one.
Red light therapy is actually showing some great promise. Dermal rolling, which I have one right here, and that's what the picture is of. High frequency devices are actually, we have them in the office. They're great to add onto a facial, and they can kill bacteria on the skin. They definitely cause some contraction and tightening. They're pretty cool. NUA is another one of the external ones, and on and on and on. Like literally on and on and on. So,
yeah. One thing we didn't talk about before, I want you to finish, but is stem cells. Just FYI, the technology and the understanding is not there yet. That will ultimately result in more skin tightening, but we don't know yet, no matter what anyone says. It's in its infancy, and we have a long way to go before we can understand how to apply stem cells for skin tightening.
For tightening, yeah.
Okay.
One of the things I didn't put on here in the on and on and on, all of these things are really more maintenance. So are they going to help improve the texture and tone of your skin? Yeah, all of these things will. Even something as simple as just rolling these little tiny needles across your skin absolutely will help improve the quality of your skin as you age. So they're great for maintenance. So, NuFace is really cool. Red light we love. Even things like, what does this say?
Beef gelatin.
Beef gelatin. So we are not sponsored by Vital Proteins, but consuming gelatin and collagen, bone broth, all of these things are going to help improve the quality of your skin overall.
What's the bioavailability of beef gelatin? If you're eating this, does it actually get in your body or?
It does. Yep. So it's you have to have the right types of collagen. So you want type 1 and type 3 collagen, which is why if you get it from a whole food source like beef gelatin versus some of these collagen drinks and supplements on the market might not have very high quality protein or high quality. That's what it is. Collagen is protein in them, whereas something that is from beef, like beef collagen, beef gelatin, is going to be far more bioavailable than some of these like manufactured
What about
collagens.
just taking a big shot of bone broth?
That's what I said, bone broth too. Like bone broth is super high in lysine. Like it's all how you get it. I mean, you can add collagen to a lot of things. It absolutely will help improve the overall quality of your
Is
skin.
it good to mix cod liver oil with bone broth? That's really the question that everyone wants to know.
Yes, for the health of your body and your skin, but I would not maybe take them mix them together because you don't want to linger on your cod liver oil.
Yeah, I remember in college there was like shots that you did not want to take, and that seems like one of them.
It's absolutely, but you do it and then follow it with bone broth, and then you don't hate your life so much.
All right, so there's tons of home options too, and actually we're big into home options. I think that doing things that are proactive at home, we're into holistic medicine, we're into empowerment, so doing some of these things at home are really good. And nutrition plays a big part of it. Destruction of your skin over time with age is worsened when you smoke, when you drink, when you do not really pay attention to eating a diet that's healthy.
Yeah, your body can only build with what you give it. So if you're putting junk in, your body will still figure out a way to make new skin cells and like make things, but the quality of those things it's making is going to be a lot less.
Right.
Yeah. So
That was some exciting stuff.
technology.
I know.
It's awesome, but it's still not the fix, the cure-all.
No. Amy and I, we're not Luddites, okay? Is that the right word? Yeah, it is. We're not. We are actually huge proponents of technology. For a plastic surgeon's office, we may be the most technology forward. Now, plastic surgeons tend to be very dogmatic. They don't want to use technology because I am the surgeon and I'm number one and look at me, what I can do. Amy and I believe that technology and the surgeon together makes everything better.
Mm-hmm. We're also not snake oil salesmen, though.
We're not. No. And that's the problem.
We're terrible liars.
This is the main problem, is that we have a real yearning desire to be honest and truthful and put good information out there. And you take it where you need to take it. But technology alone is not there yet. No matter what you read, no matter what you feel inside your body, no matter what you want to believe with unicorns and rainbows. And
no downtime and lunchtime lipo.
Yeah, this is just like surgery and look at me. And then, you go into offices and they're not malicious at all. They're not trying to be malicious. They're told this by the company. They get a piece of paper that says, this is what this does. And they literally repeat that to you. That's not the case, okay? If you want a definitive result, you're going to have to do something at least minimally invasive. If you are not willing to do something that's more procedural, then that's okay to do something that's external with no downtime. Just know that your results, at the most, you're going to have 10% skin tightening. At the most. And that's data-driven. I've looked at all the papers on these devices, or not all of them, but most of the ones that are popular. That's it. 10% improvement. Period. With the older technologies that are invasive or less invasive or minimally invasive, you get maybe 20%. Now, with BodyTite and AccuTite, you're getting up to 30%. 30% skin tightening. And that's where we are.
Yeah.
Other than that, you come to me, we'll do cosmetic surgery on you and we can get 100% skin tightening.
Right. And I think that's
95%, 97%.
One of the things I didn't say that I do say to all of our patients when we talk about skin tightening, everybody thinks that it's going to like shrink wrap their skin to their, to their body. It's not. And none of these devices have the ability to pull or remove skin. That can only be done by a surgeon actually pulling and or removing that skin. So when we say tightening, what we're really meaning in most of these is kind of bringing it closer. So if you have a lot of skin laxity, like you might bring all that lax skin closer, but it's not going away. So
yeah,
that's an important distinction.
I feel like we're bursting everyone's bubble right now.
I don't think so. I think this shows people that there are a lot of options, and that you should explore them, because if you've seen a medical spa or a doctor's office for one of these completely non-invasive things, maybe just schedule a consult with a plastic surgeon and see what they would offer you from a more invasive standpoint.
Right, and then compare.
Yep.
And the last thing is, there's nothing wrong with doing something invasive and non-invasive. Mm-hmm. And these combination therapies has always been where my mindset is like doing BodyTite with Morpheus or doing SmartLipo with something external like a CO2 laser.
Or smooth shapes.
Smooth shape, yeah. So combining these things, really maybe you can make it 5% better or 6% or 10%. So
yeah, or even just maintain your results for longer.
Cool.
Do you want some beef gelatin in that tea?
I absolutely do not.
All right. Thank you so much, everyone, for listening. If you enjoyed this episode, please leave us a comment, a like, a rating, a review, share us with your friends. It really does help. And we are going to be we've read a few more 5-star reviews on air. So if you want to hear us read your review, definitely you have to leave us one first. So
yeah.
You can find us on Instagram at Beauty and the Surgeon Podcast and on YouTube at Jason Martin MD. And thank you so much, everyone, for listening.
Thank you.
Don't forget to check out our sponsor, Let's Get Checked. Let's Get Checked offers fast, affordable, and completely confidential health testing for everything from STDs, male and female hormones, and even COVID-19, right from the comfort of your own home. And remember, new customers and listeners of our podcast get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com/beauty and use the code BEAUTY20, beauty, BEATUY 20 at checkout. Get checked. It's the right thing to do.